Welcome back, everyone. Did you all lose connection at the beginning of your group?
No.
No.
Okay, then a small miracle happened because I lost internet for a second and completely was thrown out of the full meeting.
I think it just changed host. I think it just gave, because you made us co-host.
Oh, well, that was I was in a total panic, but
You pre-planned well, right?
it's good to know for future reference. Learn something new every day that the host and the rest of you can still continue. So that's wonderful to know. So I hope you all had some really wonderful discussions. And it would be great to hear what some of the highlights were. So why don't we start with group one, Nadine and Talina? Is Nadine back yet? Oh, there she is.
And again, I was telling my group I'm on a hotspot, so I don't know what's going on. I may lag a little bit. I apologize. Jill, it's always interesting, when we've been on these meetings over and over again, how diverse we are and what a blessing that is. I've always said that I'm so glad ACL gives us the opportunity to be unique, but yet similar, so that we can address those needs in our state as we are allowed sometimes, and see based on the needs how we can approach those. So we found that out in our breakout. We all do things a little bit different, but yet the same. For a state that's been involved with the life and respite grant for years and years, I talk about working with the Medicaid program, The Money Follows the Person, to help fund her navigator program. Again, I've heard her say that before, and I guess just too busy just to really engage in that, but like that idea. Again, it seems like we're doing about $100 a month if you would round it out, vouchers. So some of us do like $600 a month, $600 vouchers for 6 months. Others do $400 for 4 months. So that kind of seemed like a magic number with those of us that are doing voucher programs. It kind of varies, I guess, but again, we're all kind of pretty hands off on letting the family caregiver decide who's going to be that provider, what that provider looks like for them. I'm trying to think what else we talked about that was.
Which big topical issue did you focus on?
We kind of jumped all over.
Okay, that's fine.
Because we could, right?
Absolutely.
We kind of did stakeholder involvement and just talked about, who the providers were and the uniqueness of, Cheryl talked about in Nevada, how they do, more of the agency providers. Oklahoma, we do family caregivers make that decision, and we try to really look outside the box as far as that provider could be a piano lesson instructor. That provider could be a horseback riding session. Some of those types of things outside the box that still gives the caregiver respite, but it also allows that individual with special needs some activity too. So we talked about that on stakeholder involvement. We also talked about how our lifespan respite grants were involved with coalitions. Seems like some of us the lifespan respite grant was the reason the coalition came to being in the state, very much so. I know in Oklahoma, and Maryland talked about that also in Idaho. But can we sustain it? Yeah, I think the coalitions can be sustained. So that's the purpose, right? So the kind of also we talked about the variety of things that the coalitions do. Some do conferences, some do strategic planning, some are advisory to other agencies within our states. Cheryl seems to be more on an advisory capacity in Nevada to other agencies. involved in caregiving. So again, across the board, those that were listening got a lot of ideas of various things to do again, which I think that's great. I think that's a great opportunity to fine tune your program as need fit in your state. That's about all we got through, Jill.
Well, that sounds like a lot. Does anyone else from that group want to add anything? Okay, group 2 then. Aida?
Yes. Hi, we actually ran out of time, but had some great discussion. And I'll touch on, although we talked about stakeholder, I really want to share about the marketing and outreach, because I think we really had some great information that was shared. One challenge was really, how do we reach an older population that's more rural? And really, the more we talked about it, it's really just that knowing that there is also not only access to internet, but limited, maybe inconsistent access, and the need to still have another way to reach those family caregivers. And I was reminded, I believe a couple of years ago, we had a state partner that shared they had partnered with the local pharmacy and having printed information that was then on the sacks or in the sacks. That is just another innovative way to try to get information out there. And of course, it was also shared working with those youth centers, senior centers, local centers, our hospitals and the clinic providers. Many of them have a mechanism of having a digital sign that could actually get the information out there at no cost in many cases. I know we partner with the local children's hospital, and I was reminded that is actually a really effective way. We may not know because we're not measuring so much in terms of how many it's reaching, but everyone, regardless of where you live, maybe there is that community partner that has that brick and mortar digital, sign, that again, that can be an inexpensive way to get the respite information out there. Food boxes was also another one that was mentioned by another state program, and just really trying to look at innovative ways that's not just electronic. We actually spent more time on those ways instead of focusing on, social media and the website, because again, those are effective ways to get the information out, but we really got into some good sharing on how do we reach those that maybe aren't accessing the online platforms. And let's see, it was also mentioned about constant contact. And again, I know we have found a great use of just having an opt-in way for whether that's family caregivers or other providers to learn about what are those programs you all are offering. So a distribution list was also mentioned, and just trying to do our best to work on disseminating actual paper to those that maybe can't get it otherwise. But from our group, does anyone want to add to that in terms of the marketing and outreach? We also talked about stakeholder, but I don't want to overlook any key points that you all want to share. Did I cover everything?
When you mentioned food boxes, Aida, did you mean put a flyer about the respite voucher program in with the food delivery?
Yes.
Okay, I just wanted to clarify what that meant.
Yes, any of those community outreach opportunities, and really coupling them with trying to disseminate the information. And working with local schools. Again, they're always great, because one state partner was wanting just how do I reach that younger demographic? And of course, partnering with the schools have been helpful. And we also talked about the stakeholder, but for the sake of time, Jill, do you want the other group to share on theirs?
Well, yeah, why don't we go to group 3 and then we can come back if we have a little more time. Tracy or anyone from
Hi
that group?
all. Yeah, hi all. Thank you so much to my group members, Megan and Amy from Colorado, Dina and Claire from the fabulous state of New York as well, and Dana and myself from Washington, and Corey from Nevada. So we had good representation. We had a good balance in our group of those that are convening the respite and those that are our state agency partners. So the dialogue really was around, I'm going to just do a recap and then turn it over to my crew to add their 2 cents. And that is expand and explore self-directed programs and outreach partnerships across the state and rural. All of those were kind of woven in all of the dialogue and the exploring, what do you do? How do we do this? You know, and there was a lot of great sharing, just wonderful wisdom in the room. And I was really honored to be a part of that group today. And I'm going to turn it over to them for any salient points of wisdom they want. Or not. So I'll leave it to that. It was recorded. So Jill, I did remember to push record.
Thank you.
After our intros. So if anybody else has more to share on that, it was that exploration of how to look at various ways and sort of, you know, looking at how that impact is on the caregiver and how can we get, you know, providers and support in the rural areas. There was a lot of rich dialogue on that and that constant care that we're all doing and how when funders, you know, out of our control change something, you know, don't award something, what that impact happens to all of us. Some wonderful ideas on how to extend those partnerships, how to, you know, those of us that are not for profits can share letters to give to providers that are helping to expand the program in whatever way that they're making a donation. So there's a lot of conversation around that, and I will.
Anyone else from group 3 have anything to add? Did any of you get to the third or try to tackle any of the questions in the third group about once a family caregiver contacts you and is in the system, the kinds of information and assistance and guidance you provide to them? Nobody got past group 1 or 2 of the questions.
We ran out of time, Jill.
Yeah,
Sorry.
that's okay. Did you want to share a little bit more about your stakeholder
Well,
information?
sure. Really, we talked about having our statewide coalitions and the local coalitions and just really sharing information across programs and agencies was key. And of course, we talked about having those formal survey mechanisms to really try to identify or hear family voice and get feedback and even help connect to other community partners. So really using formal surveys to do that and to help even better understand areas of needs because, you know, those assessments, formal evaluation processes do really help. They're in many ways eye-opening in identifying needs that maybe haven't been addressed, or even though they have been developing new strategies on how to address them. And I would say also, it was also shared, that's also very important, is that legislative development and push when you're collaborating with multiple partners at the state level and local level, that can really speak volumes in terms of having the legislature legislative efforts. And of course, just real quick recap from my notes, just having again stakeholders that are engaged and building those relationships by working together, not only through our coalitions, but ongoing. So as we get as family caregivers contact us, knowing who that community partner is to connect them with so that we can help them. And so again, from our group, did I overlook anything from my quick recap of what we discussed on stakeholder? The big takeaway too is how important it is. And of course, just recognizing that there are some challenges in terms of just making those connections. From my group, did I miss anything on the highlights?
Do any of you have questions for any of the other groups that you were not in? Or maybe a big question that you had coming into the Learning Collaborative today that you were hoping to have answered and it didn't get addressed?
Jill, this is Cheryl from Nevada. Instead of addressing that directly, I thought maybe I would share what I learned
That'd be
from
great.
the group. And one of the things that Oklahoma is doing is that their voucher, their respite funding meets as a subcommittee. And I like the idea that somebody owns that caregiver who's kind of in the gap, and that they don't get to just say, well, we don't serve that person. They have to actually say, I think, why they can't serve that individual and sign off on why they can't. So I think that's really important data that would be collected to say, this is why these programs are not meeting the need. They don't have an agency in the rural areas, or they don't serve this person because they're not young enough, or this disability is, you know, the extent of this care, it exceeds what this family can really benefit from on $100 a month, whatever the reason is, and that they feel, it felt like that they kind of still owned them, that family caregiver didn't get just dumped. They kind of were trying to do the navigation on the backside, and I really thought that that was valuable. So that family caregivers didn't have to go through systems of care. And I was thinking about our system in Nevada, our No Wrong Door Nevada Care Connection system that only has what's available. They can only really do referrals to existing programs, and having this committee that owns this caregiver until they're being served in some way. And I thought, okay, that's where emergency or funding or a gap respite program, voucher program would be fit in with all the other Older American Act funding, whatever it might be in there in that state, that somebody still owns them. Because I'm tired, me personally, I'm tired of getting families that aren't able to be served. And you know, they're calling and saying, I don't qualify for this. This isn't enough. There's not a provider in our area. I need this high level of care. And so I need to have a nurse on hand, and I can't find a nurse who will come out, or I have to pay them $30, $35, $40 an hour to come out and be there. And I only get funded $15. I can't even work and bring in that money to balance it out. So I think about all our issues where we don't have somebody who says, okay, we get to solve the problem then, and how you're going to get respite, instead of it, caregiver, you're good luck, sorry, we can't help you. So I thought that was a really great learning point for me.
That always has been something about the Oklahoma Coalition that has impressed us tremendously. The partnerships that they have on the back end to work together to make sure the caregiver isn't the one who has to figure out how to access the system. And this is really the original intent of what Lifespan was supposed to be. That partnership across state agencies and community-based agencies to make a seamless system that a caregiver can access and not have to worry about the eligibility or who's available. And I'm not sure how you continue to do this, Nadine, in Oklahoma, to have such amazing cooperation across state agencies to figure it out. But whatever you're doing there, it's truly amazing. I agree. Thank you for pointing that out, Cheryl.
And just, if we would love to share that, because I think, again, it happens because Aida, Talina, and Stephanie, they're on this call. It's nothing that I do. It's
Your internet is cutting out.
Nadine,
oh my
we lost you. I would sure
Yeah.
love to hear what you're saying.
Since,
I
since
think
Aida's the one doing it, she'd like to know what it is she's
But
doing.
the big takeaway, I think she's going to say, it's that partnership and having the knowledge and relationships of each of those programs, those respite programs. So if family caregivers contact us, we know who to connect them with. And then for whatever reasons, if maybe they are a match for that program, having a formal referral process so that those family caregivers get access to respite. It's huge. And it is, again, to the credit of our team across multiple programs, having a commitment to serve those family caregivers. So I think, I don't know, Nadine, if that's what you were going to say, but we couldn't hear you other than
am I still frozen or am I back?
you're back.
Okay, so real quick, I was just wanting to share that we've developed a survey basically with all of the respite providers. I think there's 8 in there, that when a respite provider can't serve an individual that has called them, we have this list of individuals, and all of the respite providers are on a subcommittee. We meet quarterly with everybody. Everybody knows what each other does. Everybody knows each other by first name. Everybody's got each other on speed dial. But this form, because we in Oklahoma are very adamant about, we will not supplant another program. If you make a referral to us, you better tell us why you can't serve them. And so this form is important to where if they are contacted by a family caregiver, they can't serve them, they can make the referral on this form. We put the burden on us, not on the caregiver, to find the other program. Then they fill out, they think, okay, I know who can serve this person. I'm going to refer them through this form to Aida's team, Stephanie. I'm going to refer them. They also in this form have to fill out why, like I said, why they can't serve them. Maybe because they're over income, maybe because they're not age eligible, whatever that is. They have to let us know why they can't serve them. Stephanie reviews that. If she feels like that makes sense with that program, we can serve them, then we call the caregiver and carry on. But again, it may go through a couple of different, we may get a weird case, and it may go through a couple of different agencies till we find the right one. But again, this form puts the burden on the providers, not the caregiver, to find the right provider. We're also coming out, we're developing an app, a phone app, to where the caregiver can go on the app, put in some demographic information. It will direct them immediately to the right respite voucher program. So it may be foster care, it may be adoptions, it may be DD, it may be Older Americans Act, whatever that is. So we're really trying to put that burden on our respite providers and not the caregiver. I hope that was part of what Cheryl was talking about that I was sharing. And we're happy to share that survey if anybody's interested that we use.
Maybe in another call, we could dive into this a little bit more deeply of how you originally got these agencies to buy into this agreement or this arrangement to participate at this level of commitment. And I think it goes back 10 or 15 years to the start of the Oklahoma program, and just starting out with that mindset from the get-go that these agencies were expected to participate in this program, and that tradition or mindset has carried on.
Yep.
Excellent. Well, that's an excellent way to end today's Voucher Learning Collaborative. It's all about partnerships, stakeholder involvement, engaging family caregivers, outreaching to them, and making sure that they're getting these vouchers for respite. It's all about access and ensuring that they're getting services. So thank you all very much for great discussion. Again, if any of you would like to present on your voucher program and you haven't done so yet, I think just about everyone has shared with us how their programs work. But if you have a new development or new challenges, or would just like to share what you're doing in your state, we would all love to hear from you in a more formal presentation. And then we can follow it up with these small breakout discussions to delve more deeply into specifics. But just let us know. If you have any other topics you'd like us to cover in more depth, let us know. And if you'd like to be part of the leadership team of this Voucher Learning Collaborative, please let us know. I know I speak for our other team leaders here that would welcome your involvement and engagement. So we'll see you in another 3 months. Have a wonderful rest of your afternoon, and let us know if you have any other questions. Just forward them to me or to any of these team leaders, and we can get you that information. Have a great afternoon, everybody, and thank you so much for being with us today.
Thanks, Jill, for pulling us together. Bye,
Thank you
all.
for being here. Thank you, everybody.